and my special guest is Gina Franco. She is a nurse practitioner. She also is representing our Greenville hospital system, and she spent most of her adult life helping other people and people who are dealing with cancer. And so this is a big, I don't want to take up a lot of time. The Center for Integrative Oncology and Survivorship. Now, I'm going to put all those big words away. And we've talked about that cancer is not a death sentence. Different people need different things.
Yes.
So one treatment doesn't, one size doesn't fit all.
No, not in the treatments for cancer, but also not in the aftercare or the survivorship care. So we need to look at what that person's needs are. And some people might have psychosocial needs, some people might have physical needs, some people might have both. And we can't just say one person can address those needs. And also what we're learning is you really need programs. So we know that there are risk factors that are both lifestyles and habits for both cancer recurrence as well as second cancers. So age is the largest, highest risk factor for cancer. The fifth most common cancer are second independent cancers. So we have people that have had 2 and 3 different kinds of malignancies that are totally unrelated. So what we have to educate our whole culture and society about is that it's also what you do after your treatment. It's when you go home, what you do day to day, and what you put into your body and how you take care of your body. So it's how much red meat do you eat? Do you have a plant-based diet? Did you move today? Did you exercise? They're different. Did you drink alcohol? Did you start smoking, or did you have a cigarette the other night at a party even though you quit 5 years ago? And so those things really matter in a way that it really decreases your chance of doing well over a period of time or having another cancer. But what we also know is that a lot of those things are addictive behaviors, or they've done repetitive things. If you've smoked over 20 years, a pack a day, you've inhaled over 1 million times. What other thing have you done in this life besides breathe over 1 million times? So you have this whole pathway in your brain that you've kind of hardwired, and now we're kind of telling you, don't smoke, eat this way, drop 50 pounds, and by the way, move.
And we didn't discuss the fact that overweight, I don't know if that plays a part in cancer or not, but many, many people are struggling, and with weight problems.
It definitely has a relationship, and we have research to prove that. So that now, again, there are even addictive eating disorders and people that are compulsive overeaters. But we can't just tell people to stop eating because that's not working. If it were easy, they would have did it already. So now what we're learning is we have to have programs. We have to have programs to support people. We can't just tell them to go move. We need to show them how to exercise. There's people that have never even been in a gym. And they're people after cancer, they might have a colostomy, or they might be very tired. And so we just can't tell them to go to their neighborhood gym, and they don't know that exercise really is both cardiac, both muscular strength and stretching. And there's kind of a balance there, and their body, you don't want to have them go right into all of them at full bore. They have to do it in moderation and with assistance so that they have a program.
Well, that's common sense. I mean, if you've never exercised, then you don't want to start out weightlifting and doing all these things because you could damage yourself.
Well, you would think it would be, but then if you ask people if they've exercised, they'll say, well, I went walking, or I went on the treadmill. So they don't realize they really have to do some weights, because if you don't keep your muscles, or you don't try to do weights, it's going to be very different than just doing cardiac. There has to be both of those combined.
Now, if somebody is overweight,
another whole risk factor.
I mean, that is a big risk factor, and they've got to find a way to shed some of those pounds.
So they need to get the advice of their physician, their personal physician, make sure it's safe to exercise. But what we're also finding out is that even if you have the best attempts to decrease your calories, that by far you're going to be much more successful if you add activity. And activity, you can be creative. It can be like taking stairs. It can be wearing a pedometer. So there's all different things you can do, but you also need to get your 150 minutes of exercise in per week, and that can be in 20 and 30-minute increments. But it's very, very important.
And housework doesn't qualify, does it?
Well, it depends. If you can't carry on a conversation, then it may. But again, that might just be cardiac, where you still have to go do your weights.
Okay.
And then a lot of people do yoga, and yoga is very, very good because it kind of does a fair amount of combination things.
All right.
Might not do too much in getting the heart rate up.
Now, you as an expert, could you comment on diet? Because you mentioned our grandparents and people, and they didn't live as long, maybe, so that played into it. But they probably had they didn't have vegetables and things that were sprayed with chemicals. Our whole world is full of chemicals.
It is, and it really does make a difference. So we advocate a plant-based diet, and again, people look at us like, what is a plant-based diet?
Gina,
yeah.
Clarify that.
So that means that I don't know if you remember how the plates used to be, and they used to have the plates where they had the steak, and then they had the potato and the vegetable. Well, now, we only want to have steak maybe once or twice a week at most, and we really want any of those red meats to be just a little portion of our plate, and we want more greens, because for a while there we were telling people to do more carbs and low fat. But then we realized that people were eating all of these processed carbs, and in fact they were gaining weight as well. So by and large, you really need to eat more vegetables, and they need to be less processed, and really try to minimize any fried food. So there's like simple things you can do, and it does help if you've talked to a dietitian. We have our own registered dietitian with specialized training in cancer, and we provide free counseling to all of our cancer patients at any point in time they'd like it with our dietitian. In fact, she was here and talked with you a few months ago.
It's a wonderful thing that this is a whole picture you're providing.
Yeah.
And so you try to, whatever treatment they need, that when they get through with that treatment, then it's a whole new life. And it's a way of living and looking at life. It's different.
So the other part of that is you need a staff that can talk to people. We train people to, if you go in to buy a car, that sales staff knows exactly what questions to ask you, whether you're going to buy a car that day or not. Well, we need to train our staff in healthcare to interact with patients and ask questions about lifestyles and habits that motivate people and not make them feel shame-based. And even just to ask the questions, because there's not many. We have the average time for a typical office appointment is about 20 minutes. And the average time that the amount of questions a patient asks, about 2 to 3. And it's usually about their next appointment and their next time they're coming. So there's really not a lot of time there for, now, what are you doing? Are you getting your sleep? Are you continuing to exercise? Or how are you doing with quitting smoking? All of these different things, and really how to ask those questions so that patients don't feel shameful in telling you their answers.
Now, we've highlighted, of course, the diet, fruits and vegetables. Try to put away the tobacco.
Oh, yes.
And then you mentioned earlier about alcoholic drinks. So does that have an effect on cancer patients? And if you're taking treatments and drugs for cancer and you mix alcohol with it, that can be a red flag, can it? I mean,
it can. So most of the time, we're telling people very minimal alcohol during active treatment. And we have tied some relationship of a consistent alcohol intake with certain cancers. For instance, there's a good relationship between alcohol, I think it's 2 or more drinks per day, and breast cancer. But then we also know that alcohol plus tobacco is not just 1 and 1 equal 2. It means 1 and 1 equal 3. So that's like gasoline and fire, and that together, and both, smoking is bad at any level. Alcohol in moderation is okay, but the two together are not okay. And about 90% of patients that have had head and neck cancers return to either smoking or binge drinking. So again, we need to help that population of patients because they're not doing so well on their own.
Okay, now as I want to ask you, because it seems like we're hearing more and more, and even younger people and even children who are diagnosed with some kind of cancer.
But if you also look at our culture, if you look at how we looked in our high school pictures and how the society today looks like in their high school pictures, they're 10 to 20 pounds heavier. If you look at how much we are tied to a computer, our kids are not moving. And then you look at all the fast food and all the
Yeah.
processed food, and I didn't even get into stress.
Well, we have a minute. You can address stress.
So stress is a whole other issue where we really need to be looking at how are we in our, it's not just our physical well-being, but it's also our psyche. And what is that ticker tape that's going on in our own brain? What's the other, are the nonverbal conversations that are going on within ourselves? Because that also will predict how we're going to do in any kind of change behavior. Again, you need trained people to ask these questions. We need oncology staff that knows how to get people through their treatment, but we also need oncology staff that knows how to help people on the other side with some of the things that we've been talking about today.
Can stress bring on disease?
Well, we don't know the exact relationship. We know there's a relationship with disease. We know there's a relationship with lack of sleep. And we know that it's related to the cortisol, and this cortisol is what our own body makes after we're stressed. So we know there are relationships there, but it's really hard to tease out that data when we start looking at groups of people and how stressed is this person and that person, and what was that relationship to a cancer that might have started. So it's not so easy to figure all of that out. But we do know that if they cope better, they will have better outcomes. And in some cancers, we have related, more stressful situations.
Gina Franco, and I have the website if you didn't get it, and we just thank you, bless you for all that you're doing to help people.
Thank you. Appreciate it.
Thank you. And wherever you are, we wish you good health, and we all need to adapt some of the things that Gina has shared with us today. We'll see you next time.